doctor doesn't keep me waiting. The last doctor kept me waiting half an hour without my clothes on. Made me mad.
Good morning. I'm Dr. John Baker. Welcome.
Thank you. I'm Barbara Carter.
How would you like me to address you?
Barbara is fine.
Are you having any particular problems or concerns at this time?
No, Dr. Baker.
All right. I'd like to know how you've been feeling since your last checkup. Why don't you walk through with me step by step what's gone on with you since then? Then I'd like to examine you, and afterwards we'll sit down and develop a plan together about further tests or treatments that might be necessary. I'll be glad to answer your questions at any time, okay?
This is an example of a proper opening sequence for the medical interview, one that establishes rapport and lays the foundation for an effective doctor-patient relationship, the cornerstone of medical practice throughout the history of medicine. Although physicians have always been expected to develop effective relationships with patients, recent research has shown increasing public dissatisfaction and major deficiencies in physicians' basic communication skills. One important means to correct these problems is for physicians to learn appropriate interviewing techniques and to be more attentive to the personal aspects of medical care. In my own research on the doctor-patient relationship, I have found the patient's perspective on doctors to be a particularly helpful one. After all, the patients, as the recipients of care, have a unique and crucial viewpoint on what constitutes competent and compassionate care. My goal in this videotape is to introduce some of the attitudes and behaviors that patients have described to me as being important to them in their interactions with doctors. Let's begin with nonverbal communication, because many studies have indicated that this is the most important aspect of communication.
Dr. Baker has a professional appearance and manner. His expression is concerned, yet pleasant. He smiles occasionally and at appropriate moments and conveys a sense of warmth and interest in the patient. He appears relaxed but attentive, confident yet also compassionate and understanding. He maintains appropriate physical distance from his patient, avoiding undue detachment or intimacy. To build rapport and enhance patients' comfort, Dr. Baker uses an appropriate amount of eye contact. Whenever possible, he tends to use an open body position, with legs and arms uncrossed. Dr. Baker leans forward to convey his interest in the patient, and he mirrors his patient's position, gestures, voice tone, figures of speech, speech content, vocabulary, and language patterns in a natural manner. To maintain congruence, he uses voice tones which match the mood and content of the words he uses. He uses a variety of facial expressions that match his mood to indicate interest, approval, happiness, or seriousness. He touches the patient at suitable moments, such as to convey support, to indicate understanding or approval, or to calm. He also uses his hands and arms to emphasize, to show warmth, friendliness, and openness, to interrupt if needed, or to facilitate patient disclosure of sensitive information. He avoids interrupting his patient and uses suitable nonverbal facilitatory techniques to permit her to continue her story. Dr. Baker varies his expression, gestures, voice tones, and speed in response to the patient's cue, mirroring her moods and forms of expression, and by so doing, greatly facilitating the establishment of rapport.
How you doing today?
I feel better today, but I'm...
Good, good. You're doing just fine. Your hematocrit's up, the white count is down. Things are going in the right direction.
My God, I didn't understand a word he said. I wish these doctors would explain things more so that I'd know what's going on. I don't know what's wrong with me. Come in.
Good morning, Mr. Clark.
Good
How
morning,
are things
Doctor.
going for you today?
Well, I think I feel much better today, but like I was trying to tell the other doc who was in here a second ago, Doctor, I still don't know what's going on. I have this awful pain on my right side when I go to the bathroom.
Go on.
It was really bad yesterday. Really bad.
Yes, I know. I had a stone once myself. But it's good that you're a lot better today. Once is enough for that kind of pain, isn't it?
Yeah, gee, I'm glad to know you've been in the same boat.
Yes, but we have a little bit more paddling that we still have to do.
Yes, we do, Doc. Thanks a lot.
The bit of pain that you have left is just your urinary tract reacting in spasm to the pain. I fully expect this to be gone within 24, 48 hours. And then you should be back to normal. You're pretty much over the rapids now. Smooth sailing ahead.
Great. I can hardly wait.
You have just seen how the physician's style of verbal communication can facilitate the establishment of rapport and demonstrate the physician's sensitivity to the patient's desires and expectations. The first physician's brusque style of communication leaves the patient confused and uncertain. The second physician spoke clearly and was easily understood. She avoided technical jargon and used vocabulary and vernacular appropriate for her patient's background. Unlike the first doctor, the second used clear and explicit communication, avoiding vagueness, interruptions, and rushing the patient unnecessarily. She effectively used silences, giving the patient ample time to formulate his responses and express emotion. When her patient made progress, she showed pleasure and demonstrated a sense of humor. She also effectively used self-disclosure, thus empathizing with the patient and bringing them closer together. Let's turn now to the personal attitudes and awareness that physicians need to demonstrate in their interactions with patients. Patients like doctors to demonstrate a personal interest in them beyond the medical problems they present.
My doctor talks to me about personal things. My family, what's important to me. She takes a personal interest in me, asks about my children. She talks in a down-to-earth way. It makes me feel at home, feel special.
Patients want doctors to be flexible, to accept their feelings and behavior with forbearance and patience, and not be judgmental or to use stereotypes.
I told the doctor to come in and see me because I was upset after a bad experience I had with him when I felt he was not paying attention to my feelings. He listened to me, and he was very good after that. He helped me through a CAT scan I had later. He was very understanding in my feelings afterwards. He put up with me and took what I said to heart. He did not hold it against me.
Patients appreciate doctors who allow them to take part in the decision-making.
I appreciate it when my doctor gives me a chance to agree or not to agree with the plan she's outlined. We should have a say-so. We know about ourselves, and often we know what might be the best thing for us.
Patients also like doctors to show a sense of humility, avoiding condescension and coercion, and to be candid and forthright.
My doctor doesn't have an air of superiority. I like that. He can make mistakes, and he would apologize if he did. He lets me know up front what's what, the ABCs of what's going on, the good and the bad.
Certain data gathering techniques are particularly useful in strengthening rapport.
Allow patients to tell their own story with as few interruptions as possible.
I'd like you to start at the beginning and tell me everything you can that happened since then, in as much detail as you can.
This fall, when I was raking leaves, I became short of breath and quite concerned.
Encourage the patient to discuss all major areas of concern.
Is there anything else you'd like to discuss today?
A few years ago, one doctor told me that I had a heart murmur. I wonder if this has anything to do with my shortness of breath.
Anything else?
I've been getting this strange rash right here on my shoulder.
Establish an appropriate set of priorities in the interview, focusing on the most important issues.
You've mentioned a number of concerns. Which of these things would you like to discuss further today?
Start each area of inquiry with open-ended questions.
Do you have any other ongoing medical problems that we should address together?
Pursue areas of interest with focused questions, moving from general to specific.
Are there any other situations in which you get short of breath? What happens when you walk outside on a cold day?
Investigate relevant verbal and nonverbal cues, following the lead of the patient's responses.
You look concerned about something today. What's been going on?
Explore sensitive areas appropriately, demonstrating appropriate timing in eliciting and using sensitive material, and backing off from sensitive issues if patient discomfort is excessive.
Do you have any concerns that you'd like to discuss with me now?
Enlist the aid of family members whenever possible.
Karen, would you help me listen to Mommy's lungs?
Oh, yes, that would be fun.
Patients clearly wish to be treated as unique individuals with unique needs rather than being treated as stereotypes, examples of a disease entity, or a clinical group. They interpret standardized treatment as being impersonal treatment. Patients want doctors to allow them to express their opinions about their illness, identify their fears and concerns, elicit their understanding and attributions about the illness by exploring their attitudes and beliefs, and clarify their expectations and goals about the process of diagnosis and treatment. Being responsive to your patient's needs and concerns implies a series of behaviors, including listening carefully to your patient's needs, exploring your patient's expressed concerns, attending promptly to the patient's expressed requests, as well as determining and responding to any hidden agendas which may be present. Patients want doctors to respond to them during times of heightened emotion by providing comfort and support with appropriate empathy, understanding, and respect. Patients appreciate doctors who recognize and acknowledge signs of discomfort, allowing them to ventilate their emotions by becoming angry or crying if necessary. Legitimize your patient's feelings. Tell them that it makes perfect sense that they'd feel a particular way under these circumstances. Refrain from pointing out your patient's failures and shortcomings, and be sure to convey a sense of support and partnership at all times.
Patients want to know the results of the diagnostic and therapeutic interventions and full details about their illness. Therefore, it's important for physicians to adjust the educational message they deliver to meet the patient's needs, vocabulary, and level of understanding. Provide information in small, manageable units and in a logical, easy-to-follow sequence. Incorporate the patient's ideas and answers into discussion. Address underlying emotional expressions and concerns of the patient in a non-threatening manner. And relieve fears and worries, providing encouragement and optimism whenever possible. Check for the patient's understanding of issues discussed by asking them to summarize their understanding of what they've heard.
In addition to providing factual information about disease, patients want doctors to negotiate plans by checking their understanding of their patient's perspective.
Let me make sure that I understand how you're looking at this situation. What I heard you to say.
Addressing their patient's underlying fears and concerns.
Your physical exam was normal, and I'm happy to say that there's no reason to suspect that you have cancer.
Eliciting and respecting their patient's preferences regarding options for treatment and negotiating decisions with their patients whenever possible.
We have several paths open to us at this time. Let me describe each one to you, and then you can tell me which you feel would be most appropriate at this time.
Assessing their patient's ability and motivation to modify health behaviors, and obtaining their commitment and intention to comply.
Do you think it would be possible for you to start examining your breasts each month? Is this something that you could do on a regular basis?
The doctor-patient interchange concludes with a series of closing amenities, skills which allow a patient interview to be closed successfully. These skills include notifying the patient in advance of the pending closure of the interview.
Our time is nearly up for today.
Summarizing key points of the interview.
To sum up, you may experience some mild discomfort over the next several days, but that's to be expected with this type of condition and doesn't represent anything serious.
Inviting the patient to ask questions.
I've asked you a lot of questions today. Do you have any questions of me at this point?
Providing a clear set of instructions for future plans.
I'd like you to keep taking your medication as we discussed and to begin your exercise program tomorrow. Please call me if you have any new or worsening discomfort over the next week. Otherwise, I'll see you in 3 weeks.
Using written instruction whenever possible.
Here is a list of some of the foods that I would encourage you to eat. And these are foods that I would like you to avoid as much as possible. Also, this is some material which reinforces the points we went over on the medications.
Re-emphasizing support and concern.
If you take your medicine regularly and keep up with your diet and exercise, you should begin to feel stronger soon. That's something to look forward to, and you deserve it.
Inviting patients to initiate contact in time of need.
If you don't start feeling better in the next week or have any questions or concerns, please give my office a call. If you don't get me when you call, you'll speak with the nurse first, but I'll call you back as soon as possible.
Checking the patient's understanding of instructions and plans.
Do you have any questions about these instructions that I've written out for you today?
It's all very clear to me now.
Stating appreciation for the patient's cooperation during the interview.
Thank you for your help today. I look forward to watching you get better.
Offering farewell.
Take care of yourself. Best wishes, and enjoy the rest of the month. See you in 3 weeks.
In teaching and thinking about the personal aspects of patient care, physicians seldom determine exactly what patients like or dislike. Judgments of personal features of clinical care can be made by physicians or by other observers of doctor-patient interactions. But the patients themselves who receive care have an invaluable perspective that may differ substantially from the views of those who give care or observe it. In this video, I have attempted to show you some of the things that I've learned from patients about how to care better for them. I have found the patients to be great teachers of how to communicate. Listen to one patient I talked with who summarized well what I've tried to show you.
I adore my doctor. He's honest, and there are no secrets between us. He never tells me too much or too little. He doesn't scare me. He doesn't go overboard or underboard. He gives me an opportunity to understand what's going on with me. He gives me literature to read about my illness. I can ask him whatever I need to. He'll encourage me, and he has never unnerved me. I've never lost confidence in him. Whenever he brings in another physician, he carefully explains to me why. He talks with my family. He really listens to me. He's personally concerned about me. He's always there when I need him. He cares.